Australia's advertising has largely consisted of health professionals encouraging people to get vaccinated. Not every country has taken the same approach. Let's take a look at how a few other campaigns have worked around the world.
We're going to have the vaccine now, Elton, so
right.
Just kind of pretend that you're having the vaccine from a nurse.
Oh!
What was that, Elton?
That was me, acting.
OK, let's cut there.
Thank you. Hello. My name is Michael Caine. I've just had a vaccine for COVID. It didn't hurt. Not many people know that.
We're overfighting and we're ready to win.
Watch out. Because you know what this is? It's the metaphorical door to freedom.
Some say live, some say laugh. Guess who's back? It's Uncle Bob.
And me, Rosie.
Everybody, it's time to vaccinate. Faster, Lola. No time to waste.
But you are easy, confirm say.
Aya, Rosie, come on, be brave.
Well, to discuss what Australia can learn from these countries and ad campaigns of the past, I'm joined by Simon Reynolds, who devised the Grim Reaper advertisement during the AIDS crisis of the 1980s. He joins me now in the studio. Simon Reynolds, thanks so much for being here. What do you make of some of the ads that you've seen from overseas?
Well, I think they do half the job, which is they're impactful, and I think that's great. The problem is the people who don't want to get the vaccination, and they're going to watch that and do nothing, in my opinion. OK, so what do you make of Australia's efforts so far in encouraging people to get the vaccine? Well, I think they're all about information. It's available, it's safe, etc., etc., etc. But it's not about persuasion. And our biggest risk is some say 30% of Australians who don't want to get the vaccine. We need something harder, we need something stronger, we need something more direct. OK, we'll talk about solutions in a moment, but let's take a look before that at the ad that had such an impact in the 1980s during the AIDS epidemic, and this is your commercial. Let's take a look at it now.
That in 3 years, nearly 2,000 of us will be dead. That if not stopped, it could kill more Australians than World War II. But AIDS can be stopped, and you can help stop it. If you have sex, have just one safe. So that ad used fear. Why was it so effective? Well, I think because it woke people up. You know, there's some similarities between the vaccination situation and the AIDS situation back then. The typical person did not think they were in danger of getting AIDS, just like the typical person doesn't really in Australia think they're in much danger of getting COVID. So they'll look at all the information and then just ignore it. So earlier this week, I spoke to Mike Toole, who's a medical epidemiologist with the Burnett Institute, and he categorised Australia's marketing advertising campaign so far as being rather boring and a bit dull. And he was saying that the biggest group that is vaccine hesitant is young women, and that maybe we need to be a bit more creative in terms of targeting them with using, say, Australia's female sports stars like Ash Barty and Sam Kerr. What do you think of that idea? Sure, I think that could be strong in versus the current government campaign. You know, I think the current government campaign will fix an illness, but it's insomnia. It's just going to send people to sleep. Okay, so what will work? What, if you had to come up with a strategy without giving it all away in case the contract does come your way, what would you do? Well, we don't have to worry about 70% of Australians because they will eventually get the vaccine. For the 30%, we've got to remember that there's two reasons why they don't want to have a vaccine other than it's maybe slightly irritating to do it and time consuming. The first is they think COVID's over. And the second thing is they think that they're not going to, if they get it, it's not going to be that bad. You know, it's going to be 2 weeks of flu and that's about it. We need to say to people, there's new strands coming. There's a real danger it could come back. And if it comes back, it could be 3 times, 5 times as bad. So be prepared. So you're saying use fear again? Well, use reality. There really could be strands coming and they really could be 3 times worse. But most people aren't thinking about that and they think the whole thing's over.
Do you think it doesn't just need to be television ads or newspaper ads, that we need to be thinking more broadly in terms of social media campaigns as well to hit those young people?
Oh, very much so. It has to be mostly social media with a top line, the icing on the cake being mainstream media. We also have to go deep into ethnic media so that we make an impact inside the community.
Yeah, I wanted to ask you about that. How do you penetrate those multicultural communities when it comes to mainstream broad brush advertising?
Yeah, it's a great question. The trick is to do visual advertising. And all kinds of research has shown that many cultures will react the same way to strong visuals. If it's all about the words, it obviously gets lost in translation. But a strong visual campaign, or someone famous even in those cultures, can really make it work.
The Prime Minister comes from a marketing background. Have you been disappointed that he hasn't taken more of a lead here to say that we could be being a bit more creative?
Well, we don't know what's coming. He is an expert at marketing, and it could be that he has something more impactful up his sleeve, but he needs to do something soon, because the longer we don't advertise the potential dangers in not getting the vaccination, the bigger the problem becomes.
So if there was to be a rejigging of the campaign, how long would that take? Could it be done very quickly?
Oh, it could be done in weeks, and it should be done in weeks.
Okay, Simon Reynolds, really appreciate you coming in and talking us through it.
My pleasure.